Hello, I'm Glenn W. Hunter, and again with me is Dr. James George of Excel Physical Therapy and Wellness here in the Inland Empire. And today we are going to talk about strokes, something that affects lots of families, and fortunately homeopathy is something that is well equipped to treat many people who suffer from this malaise. Dr. George, let's jump right in. When people hear about strokes, they think about devastation to their family and disrupting routines and all of these kind of things that really tend to dominate the consciousness of loved ones, and you're just caring and you're not sure. In reality, what exactly is a stroke?
Stroke is, in another way, is basically is cerebrovascular accident. You want to differentiate that from heat stroke. Cerebrovascular accident is cerebro means brain, vascular means blood vessel. Accident is, of course, we know what happened. It's an accident. So it's an injury to the brain tissue, or it could be even the upper part of your spinal cord, and that's also a CVA. We call it CVA.
Hmm. So to be clear, stress, hostility, depression, those are things that you kind of think of. They increase the risk of stroke. That doesn't mean that they necessarily cause strokes. Can you clarify that difference?
Well, we all know that when somebody has a history of a high blood pressure, they are more prone for stroke. And when you have experienced stress and hostility, that could shoot up somebody's high blood pressure, right? And that could end up in patients having hemorrhagic stroke typically. And hemorrhage, there's two main types: hemorrhagic and stroke due to infarction. Now, where there are teeny microvessels in the brain, they actually can take up pressure to a certain extent. But when the blood pressure goes up, that could break open these teeny microvessels, and the blood could actually ooze out into the brain tissue, causing. So what happens is, beyond that area where there is a leak, there's a cause of injury to the microvessel. That brain tissue doesn't get enough blood supply, so that is an infarction. But in the area where there is blood oozing out, it is a space-occupying lesion. It is putting pressure on the brain tissue and compressing the nerve cells, and that will cause the nerve cells not to be able to send signal to different parts of the brain and to our body. When you think something like you want to raise your arm up, you're thinking in your brain, actually, basically you're not even thinking. It's a volitional activity. I want to lift my arm up. The brain tissue is the one which gives the command in the brain. We call the prefrontal cortex, the motor cortex. And what happens is, immediately you move your arm. So when the brain tissue is kind of compressed, or it's like kind of pushed, it's not able to send the signal to your arm or your leg. And that's why people end up in stroke.
Wow. Okay. With so many loved ones and families that are affected by stroke without warning, a lot of misinformation is in the public domain. Frankly, how does homeopathy treat strokes?
We have a lot of remedies in homeopathy to help heal high blood pressure naturally. We have hundreds of remedies in homeopathy. So that is in the prevention point of view. Now, we do have remedies in homeopathy to help heal stroke as well. In homeopathic terms, we call stroke as apoplexy. Now, when somebody has stroke, the brain tissue is kind of not getting enough blood supply. That's the whole idea, all right? And the brain tissue is being pushed when it is hemorrhagic stroke. We have remedies in homeopathy which can help heal the brain tissue to recover faster. And a lot of case studies have been done, and it's being published how homeopathy has helped heal the stroke. With respect to homeopathy, I have I have discussed that in the podcast before. It is individualized medicine, so we need to find the correct remedy which would match a patient's symptoms with respect to which side of the body there is paralysis, whether they have slurred speech, whether they have problems of swallowing, all these things, vision issues, whether they have facial weakness. All these things need to put together, and we need to arrive at the correct remedy.
I see. Now, let's look on the other side of your house if we can. What part does physical therapy play in the recovery?
Yes, I have been a physical therapist. Let me wear my physical therapy hat. I've been a physical therapist for more than 20 years. I have worked with stroke patients and trying to help recover their weakness in their arms and legs. Yes, we do actually neuromuscular stimulation, neuromuscular facilitation, right? Trying to move the arm and also improve the range of motion and maintain the range of motion. And we hope and wait for the brain tissue to heal while we are doing this exercise, right? And we know that there are nerve cells which go from your periphery to your brain, and from the brain to your to our periphery, to our arms and legs. So what we are doing with physical therapy is kind of sending signals to the brain to kind of activate the brain to, we work on the plasticity of the brain to recover, to move the arm and leg. So typically when you see in somebody who had a stroke, they won't be able to move their arm and leg. So if it is the right side weakness, typically the stroke would have happened on the left side, except for very rare occasions, which if there is a happen in the brainstem or in the upper part of the spinal cord. Now, with respect to physical therapy, we have tried, and to a certain extent it can help, but above all, what is more important is the recovery of the brain tissue. That is where homeopathy comes in, and even functional medicine can help with recovery, earlier recovery. There is a window of opportunity with respect to recovery from stroke. Like a few months to a year or two, if you could get physical therapy as early as possible, immediately after the stroke, within few weeks, and homeopathy along with functional medicine, the recovery is faster.
Okay. So, Dr. George, how can I improve my brain after having a stroke?
That's a good question. I have learned through studying functional medicine that our brain tissue can recover well when we actually give some good nutrition and supplements. Especially, we have found that cod liver oil, at least 500 to 1,000 mg a day after a stroke, found to help heal the brain tissue, and to a certain extent. And also with CoQ10, coenzyme Q10, 200 mg per day has been found to help heal the brain tissue. Now, this is functional medicine, and research done in functional medicine, they have found that we all have, the brain tissue is basically fat. All right, most part of it is fat, and cod liver oil and CoQ10 helps. Especially cod liver oil is fat, is healthy fat. It can help replenish the injury happened after a stroke, brain. Now, yes, functional medicine can help to a certain extent, but more than that, you need, if you want to hit a home run in your recovery after stroke, homeopathy can help really well in combination with functional medicine. And of course, physical therapy as well, to help maintain and improve the range of motion, and to improve the strength in the weak arms and legs, and to improve the ability to walk.
Indeed. So, when you think about the patients that you've helped, what are the major risk factors for a stroke?
So as I discussed before, high blood pressure is a risk factor. Smoking is a risk factor. People who have a history of atherosclerosis, right? Or the thickening of the blood vessels is a risk factor, and heart problems, especially arrhythmias or dysrhythmias. What it means is the heart doesn't have a proper rhythm. Basically, there is irregular heartbeat that could cause somebody to throw up a clot. And what happens is that clot could travel up to the brain. And as I said before, there are microvessels in the brain. This clot can block the vessel. What happens is the blood doesn't go past that block, and that brain tissue, which is beyond that block, doesn't get blood supply. And that is what is infarction, and that could cause stroke. So there are umpteen reasons for somebody to get stroke, and these are the main risk factors. And lifestyle and stress. People who don't get enough sleep, 6 to 8 hours of sleep, that could be one of the reasons as well, because we know that causes somebody to have high blood pressure when somebody doesn't sleep well. And when somebody doesn't sleep well, that causes stress. So everything is kind of tied to one another. So maintaining a healthy weight is important. Having a healthy blood sugar is important. If somebody has diabetes, that could cause that is one of the reasons which could cause somebody to have stroke indirectly, affecting the heart and other tissues in your body. So yes, there are so many risk factors, and of course hereditary. Some people carry the genes for that as well. Again, that is where homeopathy can help heal those issues, and along with functional medicine.
So, Dr. George, in the event that a loved one has suffered from a stroke and is on the road to recovery, how do they reach you for help?
Yeah, you can call our office phone number at 909-792-5050. You can also Google us at Excel Physical Therapy and Wellness, and you can see our 5-star reviews. And also visit our website at excelrehabandwellness.com. And these are the ways you can reach us. We'll be happy to help you. And we also combine physical therapy, homeopathy, and functional medicine. And functional medicine also plays a vital role in helping healing patients with stroke, and even preventing somebody to get a stroke. Functional medicine all about lifestyle changes and taking the correct supplements, which would be helping you to on the road to recovery, or even maintain your health.
Outstanding. Kind of bringing it full circle, we had talked about stress, hostility, depression being triggers, and increasing the risk. And these are perilous times that we're in. So having a resource like Dr. George here to make things a little bit more clear and give you different paths to healing, I think is absolutely tremendous. Dr. George, thank you. Again, thank you for being a great resource in the Inland Empire, Redlands in specific. And I can't wait to see what else you'll be able to share for our public as they're looking to improve their healthy lifestyles.
Thank you. Thank you, Mr. Glenn Hunter.
Indeed. Once again, I'm Glenn W. Hunter, Dr. James George. And as you go back and you're encountering reentry and the other challenges that are out in the physical world, we encourage you to be safe. Again, thank you.